In this video by Deckplate we will be discussing how GERD can trigger or worsen sinusitis. Some of the most common GERD conditions can trigger or worsen sinusitis experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. How GERD can trigger or worsen sinusitis. Your service-connected GERD can be the cause of your sinusitis. Gastroesophageal reflux disease, GERD, commonly referred to as acid reflux, is a condition in which stomach acid or bile irritates the esophagus, leading to symptoms like heartburn and chest pain. Furthermore, GERD damages your throat lining, leading to increased bacterial growth that leads to sore throats, hoarseness, laryngitis, as well as existing throat conditions such as sinusitis or rhinitis. How GERD can aggravate or worsen sinusitis. Gastroesophageal reflux is a fairly common cause of sinusitis. It can aggravate or worsen sinusitis in different ways, including acid reflux. Reflux of stomach acid into the throat and nose is one of the most common underlying causes of sinusitis. This type of acid reflux often occurs without heartburn or indigestion, which would otherwise alert a patient to the condition. Many who experience reflux also experience heavy postnasal drip and sometimes a choking sensation. Inflammation of nasopharyngeal mucosa. When a patient has gastroesophageal reflux disease, the gastric juices from the stomach back up into the nose and throat, causing the mucous membranes of the nose and throat to come into contact with the acid in the gastric juice, so it becomes acidic, affecting the function. The action of mucus hair on the surface of the nasopharyngeal mucosa leads to inflammation of the nasopharyngeal mucosa, edema in this location, blocking the sinus openings and eventually leading to sinusitis. Sympathetic nervous system stimulation. Another mechanism that causes gastroesophageal reflux to cause sinusitis is that the acidic gastric juice from the stomach stimulates the sympathetic nervous system and the respiratory organs, causing symptoms of sinusitis such as nasal congestion, secretions, nasal mucus, and postnasal discharge. Some studies also suggest that gastroesophageal reflux has infected the upper respiratory system and including the sinuses, with the cause believed to be caused by bacteria from the stomach and intestines and other digestive organs. Sinus infection. GERD has been linked to an increased risk of sinus infections. Stomach acid can travel up the throat and irritate the lining of your nasal passages, leaving them prone to bacteria growth and infection. People living with GERD are especially at risk of chronic sinusitis, an inflammation in the nasal cavity lasting more than 12 weeks that leads to symptoms such as stuffy nose, facial pain and pressure, postnasal drip, loss of smell and taste loss, and cough. Laryngitis. People living with GERD may notice their symptoms worsen when experiencing laryngitis, an inflammation in the voice box that affects speech and vocal range. Stomach acid can irritate vocal cords, making it hard to talk or breathe properly, plus, hoarseness, sore throat, and persistent coughing may occur as a result. Chronic cough. Acid in the esophagus burns the sensitive tissue in that tube, and it can do so all the way up into your throat. If that happens, you may experience a persistent, dry cough that doesn't produce any phlegm and feels more like irritation or something caught in your throat. You may feel like you always have to clear your throat. If you aren't coughing, but you're clearing your throat regularly, your body may be signaling that you have GERD. Rhinitis and allergies. GERD may worsen existing allergies or asthma symptoms by increasing airway inflammation. Acid reflux can irritate mucous membranes in the nose, leading to rhinitis, inflammation of nasal passages, which results in congestion. With allergies, you may experience more severe respiratory symptoms due to this irritation of their airways caused by GERD. Thank you for watching our video. Please don't forget to subscribe and like our videos.